A medical study in Mumbai, India, has found that more than half of the city's slum residents have been infected by COVID-19. 65% of the city's population live in slum areas. Overall, the study also found 1 in 6 of Mumbai's residents are infected. The survey results come a week after a similar study suggested that almost a quarter of New Delhi residents are infected with coronavirus. Rebecca Bundan joins us from Mumbai tonight. Rebecca, Mumbai has a population of about 12 million. If these medical results are anything to go by, is that a signal that India's official case numbers are vastly underreported?
Well, certainly medical experts have been saying for some time that the numbers we're seeing coming through officially from India in terms of the number of confirmed coronavirus infections is significantly lower than the actual number of infections in the country. And that's largely because the rate of testing is still relatively low in the country. It's still much, much lower than it could be. And that's been a factor, although India has increased the amount of testing that it's doing and is continuing to increase the amount of testing. Also, there have been some questions about whether all the data is going through into these numbers as well. But the findings of this latest study from Mumbai are extremely interesting, showing that 57% of those people sampled in the slum areas were infected. This survey looked at 7,000 samples, and it looked at 3 areas of the city. So certainly it doesn't give us the full picture as such, but it certainly shows a lot of interesting information. And that was what was expected, was that the virus would spread very rapidly in slum areas, because you do have these heavily overcrowded areas in the city where you have tiny houses, sometimes 10 people living together in a very, very cramped space, these narrow little lanes. Hygiene is also very, very poor in the slum areas as well. That sometimes the toilets are shared by dozens of people. So it was expected that the virus would spread rapidly, although these numbers are considered higher than some would have expected. And also those numbers showing that 1 in 6 outside of the slum areas are potentially infected, and that they had the antibodies suggesting that they may have been infected with the coronavirus already.
India entered a 21-day nationwide lockdown this week to try to stem the spread of COVID-19. Authorities are urging people to observe safe distancing, staying 1 meter apart. But for the country's millions of poor, that's a challenge. Rebecca Bundan has more from Mumbai.
Personal space is a luxury in India's financial capital of Mumbai, which is home to some 20 million people, and millions of these people live in overcrowded slums. According to an Indian census, 1 in 6 of city residents in the country live in slums, and in Mumbai it's more like 40%. The Indian government has enforced a nationwide 21-day lockdown, and the idea of this is to encourage safe distancing to try to help break the chain of COVID-19 transmission. But the reality is that given how densely packed these slum areas of Mumbai are, with many family members crowded into tidy spaces and hundreds of homes crammed in narrow lanes, poor people aren't necessarily managing to keep a safe distance from each other. There's also poor sanitation in these areas, which often rely on communal facilities and have restricted access to water supplies. So this makes hygiene a major challenge. While people are being told to wash their hands regularly, this isn't so easy when water supplies are limited. Some health experts are saying that more needs to be done to help poorer residents practice good hygiene, including increasing access to sanitation facilities and water. The Indian government has announced a relief package for the poor, including free food. But the potential for the virus to spread in slum areas, even during the lockdown, is an unnerving prospect. Rebecca Bundan, CNA, Mumbai.
To India now, where members of the international community are praising Asia's largest slum for combating the coronavirus, even as new threats continue to rise. Health officials in Mumbai have ramped up their response efforts in Dharavi, a densely packed shantytown where around 1 million people live. So because social distancing and contact tracing essentially impossible to enforce, city leaders and teams of doctors have moved in to contain potential outbreaks. A new Washington Post article explores Dharavi's success story, even as cases climb across India. So we want to bring in Neha Masi. I hope I said your name right. You wrote the article, and you were coming to us from Delhi. So this is really fascinating. First off, did I say your name right? And did I say, am I saying Dharavi right?
Yes, absolutely. Both of them. You got that bang on.
All right, good. All right, so describe Dharavi to me. What is the place like? And then, tell me about the efforts that they implemented that were so sort of different than what we've been seeing elsewhere.
Right. So I think what's important to understand here is that Dharavi is not an ordinary slum. It is a 1 square mile area, which would roughly be about 3/4 the size of Central Park. There are 1 million people who live there, as I said. So it's one of the largest slums in Asia. There is also a huge informal economy, which is, which works out of Dharavi. So in 8 by 8 feet tiny rooms, people live and work, and sometimes that could be like 10 people in one room. A majority of the people don't have access to toilets in their homes. That means they rely on community toilets that are used by thousands of people. So if you sort of, think about the challenges, the magnitude of the challenge they faced was definitely immense. Narrow, crowded alleys with no possibility of, any social distancing or contact tracing. Like, it would be a massive challenge. One of the officials told me that, how do you think I would be able to track down contacts of a person who's used a community toilet? So all of those things were huge, issues, and so the solutions that have worked elsewhere in India or globally just would not work here.
So then, geez, I can't even imagine how you take on a challenge like that. So what did officials do?
I think what was interesting for me about this story was not just that this was a slum, but the fact that the officials and people who were working there used the resources that they had in place and came up with their own, adapted solutions. So for instance, what they did was, in the first 10 days of the outbreak, they narrowed in on areas that were reporting cases within the slum and went door to door to screen every single person. They checked the temperature levels, they checked oxygen levels, they checked for symptoms, they checked travel history. They screened about 50,000 people in like 10 days. Out of that, they found 4,000 people that were sent off to quarantine. They tested 400 people with symptoms, and 20% of those tested positive. So one of the officials said that the idea was to chase the virus instead of waiting for it to be reported, by which time it could have spread much further. The other thing that they did, which also helped, was they opened medical camps at major points in the slum where people could just walk in and get tested for free. Back in April, getting tested was not so easy or affordable for many people in India. So that was also one thing that sort of broke the access issue, sort of became easier. The third thing they used were local doctors who work in the area. There are about 350 private clinics throughout the area, and at least half of them opened up after the government requested them. And the doctors were provided with PPE kits, their clinics were sanitized, and people actually felt more comfortable walking into a doctor's clinic who they knew, instead of going to a government-run facility outside the slum. So through those clinics also, they managed to identify a lot of people who were then tested or taken away to quarantine. So that was one set of things that they did. The second very important critical thing that they did was to ramp up health infrastructure. There were no government hospitals with beds or intensive care equipment inside the slum at that point. So they had to create everything from scratch. They took over a sports complex, they took over a park, they took over marriage halls, schools, and created quarantine facilities for thousands and thousands of people, which they then could isolate, so so the spread gets checked. And also they built like a 200-bed hospital, at an empty plot of land within like 20 days with oxygen beds. So both of those things were very critical. I mean, in India, healthcare infrastructure is poor overall. At the start of the pandemic, India had less than one bed for 1,000 people. So you can imagine the scale scale of the need at this point. Healthcare spending is less than just over 1% of the GDP. So all of those things was an additional challenge. And the third thing that they had to also deal with was the humanitarian crisis that accompanied the pandemic, which was much more acute in a place like Dharavi than elsewhere. These are people who are working every single day and earning their daily wages and surviving on that. With the lockdown, the economy shuttered, people lost their jobs, and they didn't have anything to eat. And that's where some of the international community efforts sort of helped, given the fact that Dharavi is famous globally for some good, some not so good reasons, and it's been featured in books and movies. Of course, the most popular one being the Oscar winner Slumdog Millionaire, which was partly shot there. There were lots of NGOs who already worked in the area, and so they sort of stepped up to provide food aid. The government was also, of course, trying to run some of these kitchens, but those efforts were not enough. So a lot of the NGOs and private donors stepped in to help residents who were tied over that time, which was also very crucial. So the government had to actually fight both a health crisis as well as a humanitarian crisis.
I mean, it's truly impressive. And I remember that, at the beginning of this whole thing, India was really praised for how rapidly they were able to shut down the entire country. But as you point out, they could only do that for so long because people need to eat, they need to live. But when they did shut down the country, many people who were living in the inner city, living in the slums, went back to some of their villages. They are returning now. How does that complicate things for Dharavi?
Right, absolutely. So, I mean, the fact that they've managed to beat back the virus at this point doesn't mean that it can't return, given the peculiar nature of this disease, and they're fully aware of that. During the lockdown, about 150,000 people actually left, and that's a conservative estimate. It's hard to, get an exact figure about it. So now that the lockdown is, opening up, the economy is opening up, some of the factories are working now, people are returning and will return later this month, which will be from different parts of the country, which are also seeing outbreaks. So they could be potential carriers. The other problem also right now is that this is the peak of the monsoon season in Bombay, and this week has seen some of the heaviest rainfall in decades. So that means that there could be viral and malaria outbreaks, which are common at this time of the year. The challenge will be then twin to monitor who's coming in from where, and also to distinguish between symptoms of a common viral from a coronavirus case. But good news is that things are under control right now, and they are and they're ready for whatever comes next.
Yeah, it's really sort of a great story. But then the other thing I kept on thinking, though, is can this be replicated elsewhere? You talked about how Dharavi is kind of unique. Are they applying some of the lessons they have learned to other areas of India?
Yes, I think definitely. I mean, there are certain things that can be replicated and some that don't. And as I said, I think the idea is to what is the biggest lesson perhaps in this story is not to have a template of these are the things that will work, because each area will be different and have its own set of challenges. So how do you adapt to that situation is what is going to be in question. But I think in densely populated areas, to try to break the spread, it is critical to quarantine people as soon as you can and detect it as early as possible. And secondly, also, engage the community, because that was also a big challenge for them, where there was a lot of fear and stigma amongst the population about this disease, which often leads people to hide instead of reporting it. So these are some of the things that definitely, like other parts of the developing world, as well as other densely populated pockets of India, could learn from this example.
Neha, it's a really fascinating story. Thank you so much for joining us.
Thank you.
%60 of Mumbai's COVID-19 deaths are in its slums. Its biggest slum is also its biggest problem, Dharavi. The writing was on the wall ever since the first case was detected in Dharavi on the 2nd of April. It took just 30 days to zoom to 600 cases, and that curve is showing no signs of flattening. And it's not just Dharavi. Mumbai's slum belt from Mankhurd to Shivaji Nagar, as well as the slums of Kurla, Mulund and Worli, are hotspots too. The reasons are obvious. Social distancing is impossible. Hygiene has always been a challenge. The other challenge, Mumbai's crowded jails. They were always on the high-risk list. Despite early orders to decongest and isolate jails, 100-odd people, both prisoners and staff at Arthur Road Jail now, have tested positive. Police personnel elsewhere in Mumbai too are falling prey to COVID-19. More than 30 cops have tested positive at JJ Marg police station alone. The other frontline personnel at risk, healthcare workers. Wokhad Hospital was sealed with more than 80 staffers testing positive so far. In Jaslok Hospital, the figure is close to 60. Nanavati Hospital, Bhatia Hospital have also recorded cases. A fresh worry: the wholesale vegetable markets. The APMC market has been shut down after nearly 100 workers here tested positive. This is the market which is the biggest supplier of vegetables and food grain to Mumbai and its adjoining areas. Slums, jails, police, hospitals, markets. That's where maximum city needs maximum intervention.